We've got to continue to stand up for a woman's right to make these decisions and to defend Planned Parenthood, which does an enormous amount of good work across our country. I'm a big supporter and defender of the Affordable Care Act. We're going to get out-of-pocket costs down. We're going to get deductibles down. We're going to require more free services within the benefit package, and we're going to go right after prescription drug costs. I took on the drug companies. I took on the insurance companies. Before there was something called Obamacare, there was something called Hillary Care.
All week we've been examining the health care plans of the presidential candidates, and today we're checking up on Hillary Clinton's plan. Fox News Medical A-Team Dr. Mark Siegel is here to break it all down. Nice to see you, Doc.
Great to see you, Clayton.
It sounds like she's doubling down on Obamacare, but she says, I love it, but she's also admitting there are a lot of flaws with it, to her mind.
Well, actually, though, the problem with the flaws that she's finding is that she's addressing one of the main problems with Obamacare, but making it worse, which is the two main problems with Obamacare, to boil this down, are, one, you're not getting the access to the health care that you hope to get. You don't necessarily get your doctor. There are narrow networks of doctors involved. Obamacare isn't working in the doctor's office because it doesn't cover what people want. The other problem is it's enormously expensive, Clayton, close to $1 trillion projected over the next 10 years. Enormously expensive. And you can see that up on the full screen. The problem with Hillary's plan is everything she's proposing increases costs to the federal government. She wants it to be $5,000 per family to help people handle the deductibles of Obamacare. Where's that $5,000 going to come from?
Right, because she says, look, the deductibles have gone up. So we've seen deductibles going up for individuals. She says she wants to slow the rate of the out-of-pocket costs and make those premiums more affordable.
No, exactly. Now, she wants to decrease the amount you could spend on prescription drugs. In other words, that she wants to cap expenses of out-of-the-pocket expenses for drugs and for premiums. When it comes to prescription drugs, that's going to stifle innovation with the drug companies. That's a problem with that. We're heading into a section of medicine right now where we have innovation, and it's not one-size-fits-all anymore. So drug companies need the money to develop new medications. If they're stifled, and also, she's promoting generic drugs. She wants generic drugs to be fast-tracked through the FDA. That may actually help in the doctor's office. The problem with that is drug companies are going to be stifled as a result. She wants Medicaid expansion to the remaining 16 states that don't have it. That, again, may sound good, but Medicaid has not been reformed. It's an enormous burden on the federal government.
Okay, so what do you like about this plan? Are there any things that stand out that say, yeah, we actually need that reform?
Well, I like the idea of families not struggling as much. I like the idea of there being a cap on prescription drug expenses out of pocket because people can't afford their drugs. We're seeing that more and more with seniors. I like the idea of women having more access to basic health care, but I don't like the idea that she's making it easier to get an abortion. Abortions are already overused in this country, you know, so there's no brakes on the system. The key with Hillary's plan is there's no brakes on the system, and she's not acknowledging the fact that the ACA is inefficient. It's overpriced. The biggest problem with the ACA is it's way overpriced. This may end up doubling the cost of it. I don't know where this money's going to come from. It's being called a job killer, Obamacare. This is going to make it more of a job killer.
Doubling down on Obamacare. She says she loves it. And I like that she ties it in and says, you know, it used to be called Hillary Care.
Oh, well, that's another final point, by the way. She started this in the 1990s with Hillary Care and said you could go to jail if you didn't have health insurance. That led to the HMO movement, where quality of care got watered down in this country. As a physician, I want quality of care preserved in this country. The Affordable Care Act has attacked quality of care. This will make it worse.
Dr. Mark Siegel, thanks so much.
Great to see you.
Appreciate it.